Hello everybody, it's Cookie Lou in Arizona. Today's Tuesday, February 7th, and I had my 2-week checkup with my wonderful surgeon, Dr. Schuster, who did my DS surgery, and he was very pleased with my progress. He said my incisions have healed perfectly, and I look good. He's happy that I'm feeling good, that I didn't have any nausea or any vomiting or any problems of uncomfortable nature. We discussed my blood work. He gave me an order to have my blood work done, and I will go down to Sonora Quest and have that done, and see him in about 2.5 months to review how my vitamin levels are. I showed him the vitamins that I am taking, and he said that was perfect. He says, you don't have to take a whole lot, actually. I know there's other people that might take, like 30, 40 vitamins a day. He says you don't really need to do that because your body is only going to absorb what it absorbs anyway. As long as you get the basic ones in, which is what you're doing, you should be fine. Anything that needs to be adjusted after we get your blood work back, we'll take care of it then. And we just reviewed a few things. We talked about my pain. Was it uncomfortable? Was I happy with the stay in the hospital? Did the nurses take care of me properly? And I said, yes, they did. And he said, well. And then I asked him about the pyloric valve situation. I said, I was kind of looped on drugs when you came in. You did mention a little bit, about what was wrong. He says, when I got in there, he says it was purple. It was like all blue and purple and gray. And I says, well, what caused that? I said, a little bit of this first sleeve operation. There was a couple of blood vessels that just weren't producing enough blood and oxygen to that area. And a little bit was me. He said, and I was in there doing my thing, with the scalpels and everything, and I just saw that those blood vessels were, not good, and I had to cut that area. So I had decided that if I left it in there was going to be a higher risk of you having a leak, because that's the area where they make the anastomosis, in that particular area where leaks happen. The connections that they make in the lower part of the stomach, they staple that. There's no leaks that happen there. It's that area right there by the pyloric valve and the duodenum. That is a touchy area, and he says to me, I didn't want to take a chance of this whole DS surgery going down the crapper. He said, I'm not worried about it. He says, the only thing that could possibly happen is that you could get have a higher risk of ulcers in that area, but I'm not worried about it because most patients don't get ulcers. He says it doesn't compromise your digestion at all. The sleeve is very long. He says, so anything that you digest as far as food or medication, tablets, or vitamin pills will stay in the belly of the sleeve for a while, not a long time, but then it's going to go right into the small bowel because the valve is not there anymore to hold things in place. It's going to go right in there, which is where most of the digestion happens anyway. He says, so don't worry about it. I'm not worried about it. He says, you've been taking your vitamins, right? Everything's fine. And I says, yeah, I'm feeling really, really good. He says, I'm really happy. He says, you look great. He says, the incisions look great. The way you've been feeling since the day after surgery, you did so well in the hospital, you're doing well at home. I'm very, very pleased. So that's about it. But then I went to the hospital and picked up some the notes. I didn't look at them yet, but the notes on the surgical report. They gave me everything, blood, all the testing that they did, and blow by blow what happened with the surgery. I always like to keep reports. But the most wonderful thing that Dr. Schuster told me today was, I can eat. Look at this, people. I can eat soft foods. Look at that. I got a delicious piece of tilapia. Mmm. Heaven. And some carrots. Isn't that delicious? I'm in heaven. You tell me you can have soft foods. You can have an egg. I says, well, I have a piece of tilapia at home with my name on it. He says, love it. Best thing you can eat. Enjoy it. So I'm enjoying my tilapia. That's it, everyone. Have a good evening. Bye.